DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and today we're going to talk about common feed additives. We're going to talk about things that help reduce acidosis, that reduce bloat, that suppress estrus, and many more. Thanks for joining me today, and stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, nematovirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road. Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm a veterinarian, and I'm a professor at Iowa State University and also a practicing veterinarian with production animal consultation, and travel between Iowa, Kansas, Nebraska, in that general vicinity, working with great people in this industry every day. Today we're going to talk about something that's very common, something that we do routinely, that we have premixes, that we have supplements, and sometimes we don't think so much about. But they're the tools that are there, these non-nutritive feed additives, are there to improve feed efficiency, to promote faster rates of gain, to improve animal health. And they do that's the primary effects, with the secondary effects of reducing acidosis, decreasing coccidiosis, reducing bloat, reducing liver abscesses, suppressing estrus, which all along the way equals a decrease in the cost of production and an increase in the revenue and profit potential for each animal. Now, as I think about this and break it down, there are different classes of compounds that we use as feed additives. We have antimicrobials or antibiotics. We have ionophores. We have beta-agonists, which are for growth promotion. We have estrous suppressants. And we have probiotics and coccidiostats. And a lot of time our ionophores are coccidiostats, so we kind of lump those together. But let's start out by talking about the two most common antibiotics that are used as feed additives, okay? One of them being tylosin, and the trade name is Tylan, or chlortetracycline, AS700 chlortetracycline, CTC, okay? We use tylosin in rations at an extremely low rate in feedlot rations to reduce the prevalence of liver abscesses. And we feed it from 8 to 10 grams per ton or to 60 to 90 milligrams per head per day. To feed any of these products, you must have a valid veterinary-client-patient relationship and a veterinary feed directive, which gives you the directions in which cattle this can be fed and what level and so on. And you have to maintain those records for 2 years. But with Tylan, we will feed this at a low level every day while cattle are on feed, and it helps prevent or control against the bacteria called Fusobacterium necrophorum. Fusobacterium necrophorum causes 3 syndromes in cattle: foot rot, diphtheria, and liver abscesses. When we feed tylosin, it's a macrolide. It's a great tool to control liver abscessation, which then improves the health and the production of the animals. Chlortetracycline, CTC, is commonly used, can be used to control liver abscesses, but more commonly, it's used as a feed additive to help treat bovine respiratory disease. And we can feed this at a certain level. Remember, work with your local veterinarian, and you can feed that for 5 days. If it says 5 days and it has that dosage rate, that's where we have to feed. Not even a veterinarian can extra label that product. But we can feed that to control respiratory and treat respiratory disease, which then improves cattle health without having to run them through the chute. So those are just two examples of antibiotics. When we come back, we'll talk about ionophores. You're watching DocTalk, and I'm glad you joined us.
Hi, my name is Dr. Kirk Ramsey. I'm a professional services veterinarian with Neogen. On this episode of Cattle Intel, we're going to talk about the ins and outs of obstetric chains. Chains are used to provide traction when a calf is being delivered. They are strong, easily cleaned and sanitized. They're also meant to be used with OB handles, which allow a lot of flexibility when they're used together. It's important though to clean and sanitize and dry the chains quickly after each use because they are prone to rust and damage if not cared for. Probably the most important element when using chains is knowing how they should be placed on the calf's legs. To place them, a loop is created at the end of the calf chain, which is placed above the fetlock of the calf. A half hitch is then made in the slack and placed below the fetlock and above the hoof. This distributes the pressure along more parts of the leg than one single location. We do this because excessive pressure on one direct location can cause bone fractures and tissue trauma. Another key element is to always place chains along the top of the foot and not along the bottom. That way we don't cause tissue trauma to the vaginal wall of the dam while pressure is being applied. OB chains are a critical piece of your calving kit. Be sure to apply them correctly, keep them clean, and only use them when necessary.
Thanks for watching Cattle Intel by Neogen.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and we're talking about feed additives. Something we do commonly, something that we feed. And one of them that's very common is an ionophore. An ionophore functions to alter rumen bacteria to help change them from producing more acetate to producing more propionate. And propionate is a volatile fatty acid that when the animal digests hay or digests corn, they give off either the bacteria consume the starch or the cellulose, and they use that glucose then to produce microbial crude protein. And the byproduct, or the byproduct of that fermentation is what we call a volatile fatty acid. And there's three main volatile fatty acids: propionate, acetate, butyrate. As we increase the roughage level, we'll have more acetate produced by the bacteria. As we increase the grain in the ration, we have more propionate. Propionate goes across the rumen wall, goes into the liver, gets slapped together, and we make glucose. And that's what the animal then, the ruminant, uses. We as monogastrics just break it down and absorb glucose as glucose, but since the bacteria break it down first, the ruminant animal absorbs the propionate, which is much more efficient at producing glucose because it's 3 carbons to make 6 carbon of glucose, versus acetate being 2 carbons, needing 3 of them to come together. Acetate is more of a precursor for fat. So, when we feed an ionophore, we're feeding it so that we get more propionate because it changes the bacterial population in the rumen to producing more propionate, which is more efficient, which then we may not have an increase in intake, but because it's being used more efficiently, we will have an increase or an improvement in our feed conversion, which is decrease our cost of producing those animals. Other characteristics of ionophores is it can be somewhat limiting on intake and help stabilize intake day over day with the animals. And so when we see this stabilizing effect, it decreases the number of digestive deaths decreases acidosis, decreases sequelae like bloat and laminitis, and things to that nature, which also improve the health of our cattle that we feed. Ionophores also function as a coccidiostat, meaning that they attack Eimeria. Eimeria is the kind of the fancy name for coccidiosis causing parasites. But when we feed ionophores, such as monensin, at the level of 20 to 30 grams per ton, we will control coccidiosis. And so when you start to think about the importance and the relevance of ionophores, ionophores are not used in human medicine or used to treat diseases in human medicine. And so there's no concern on the antimicrobial usage or stewardship front. Some people kind of debate that, and I can see both sides of ionophore since it's changing the bacterial population in the rumen. But at the end of the day, I get back to the common sense of what are we going to use it for anyway? It's a great tool. It's something that improves feed efficiency, controls coccidiosis, and also decreases digestive insults in cattle. So using an ionophore, I would guess there are very few cattle in the country that are raised in a feedlot without an ionophore. Great tool, been around a long time, something we should utilize. When we come back, we're going to talk about estrous suppression and MGA. You're watching DocTalk, and I'm sure glad that you joined us.
Every farmer knows that understanding the landscape is the most important ingredient for success. When it comes to investing in precious metals, United Patriot Coin can help steer you in the right direction. No obligation, just solid advice. Call now for your free guide, 844-202-7834.
We have fed for the same customers for the last 10 years. I know their cattle. Sometimes cattle can come in a little wild, long haul cattle. Those types of cattle get therapies to help those settle in better. And we have also adapted that a lot of our sick cattle, by the time a cowboy pulls them from their pen, drives them to a hospital, and then either getting returned to the hospital or returning to the home pen, I believe that's a lot of stress on the animal. So anything that's been treated gets therapies, and we have seen success with that as well.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. Thanks for joining us today. I'm a professor at Iowa State University in the Department of Animal Science, and I'm also a practicing veterinarian with production animal consultation. I thank Iowa State University for all the opportunities they've provided me, along with Kansas State University, to be able to chase my passion, serve people in a unique manner, and still work with students and stakeholders and faculty and all the above. So I'm very, very blessed. And anyway, we're talking today, and it's something I teach a lot about, is our feed additives. And the other feed additive that we feed to heifers in feedlots is called melengestrol acetate. You know it as MGA, okay? So what is MGA? MGA is a progesterone analog. And that analog then is absorbed into the body, and it is used then as a progesterone type product by the heifer. So if the heifer has an ovary that has a corpus luteum or a CL, that CL is producing progesterone. And as long as that's producing progesterone, the animal is not in estrus or in heat, okay? So but once that CL or that corpus luteum ruptures off of that ovary, progesterone ceases to be produced. The animal then we get estrus, and we get estrogen increase, and that animal then ovulates and exhibits estrus in the pen. And that's when we get riding and mounting and injuries And if we have increased riding and mounting activity in the pen with the heifers, we have increased injuries and we have decreased efficiency of feed because they're using that energy up as they're displaying these sexual behaviors in the pen. So we feed MGA at 0.25 to 0.4 milligrams per head per day. And when we feed that at that level, that is enough of a progesterone analog to help that animal maintain and think that it's non-estrous. It suppresses the heat. So we've had some debate in the past and debate recently on the efficacy of MGA in suppressing heat, and as we feed these heifers bigger, do we still need to feed it? And I think that when you look at the body of literature out there and you look at the meta-analysis today, it's kind of hard to argue not to feed it to suppress estrus in heifers when they're in the feed yard. The only other way to really do it is to have those heifers spayed prior to feedlot entry, and it really does not gain you performance to do that. But if you're feeding cattle that can't be fed these types of products in different types of programs, then that's what you have to do to suppress heat, or you have to live with the consequences. What we have seen in research is that rather than feeding the top level of 0.5, Chris Reinhardt did a meta-analysis that showed that feeding at 0.4 milligrams per head per day over thousands of head of cattle was equivalent in suppressing heat and having the improvement in performance. And so that's roughly where most people are at when they're feeding MGA in feed yards. It's a great tool, a great opportunity. Now, one of the things that is up for debate, if you do have pregnant heifers that come into the feed yard and you're going to abort those heifers so that they don't have a birth while the cattle are in the feed yard, there are people who believe that we must pull those animals off of MGA because not only does it suppress estrus, but maybe it potentiates pregnancy. So pull them off of that before we give them a shot of Lutelice, before we try to abort those short-bred heifers. So that's MGA. So we've covered antibiotics, we've covered ionophores, we've covered the the estrus suppressors, we've covered the estrus suppressors. When we come back, we're going to talk about beta-agonists and some dewormers. You're watching DocTalk, which we're glad you joined us.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator. addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and I'm here in Ames, Iowa at Iowa State University, and also out of Kansas where I work with production animal consultation. We're talking about feed additives, and we've talked about antibiotics, we've talked about ionophores, we've talked about Estrous suppressants. And now we're going to talk about something that promotes growth directly, and that's a beta-agonist. Beta-agonists have been around since legal in the U.S. for about a little over 20 years. It was introduced first. We had ractopamine brought on the market. We then had zilpaterol, and now we have a new compound that's on the market. It's called, the trade name is Experior. They're utilized at the end of the feeding period. Beta-adrenergic agonists have a direct effect to increase protein synthesis and decrease protein degradation, which means the muscle's going to grow, okay? We're going to have an increase in the muscle size. They also have an effect by causing lipolysis, which means it's going to decrease the amount of fat, or at least decrease lipogenesis, or decrease the production of fat. So when we add this at the end of the feeding period, when the animal has the most efficient point in time in feeding of gaining carcass relative to body weight, because the head's fully grown, the bones are fully grown, and now we're just laying down carcass, we have an opportunity to accelerate the carcass growth, increasing hot carcass weight, while also improving the feed efficiency at the time when the animal is probably the least efficient at converting feed to gain. So really important products that we use the last 30 days on feed, last 30 to 38 days on feed, depending on which one that you're utilizing. Make sure that you work with a nutritionist on making sure you're using it in the right class of cattle, that you're using it at the right time period, the right length. Some products have a withdrawal, some products don't. Just understanding all that, what it's going to impact you management-wise. But if you aren't in a specialized program and you're looking for ways to increase pounds of carcass and efficiency of carcass, these are great tools. Okay. The last product or last compound I'm going to talk about is an anthelmintic, or something, a dewormer. Okay. And probably the best dewormer that we have to put in the feed, and as a feed additive, that if you want to deworm cattle out on the pasture, or if you want to deworm them in a dry lot in a grow yard situation, is fenbendazole. And fenbendazole is a highly effective dewormer. We use it as a lot of times as a paste. If you're using a white dewormer and you use Safeguard, that's the trade name. Safeguard is the one that comes in the feed, or comes in a drench, and it's utilized routinely in the United States, and it's great for control. There's a lot of times that we will use the feed additive Safeguard or the drench Safeguard in combination with an Ivomec-type product, injectable type product, or pour-on. And the thought process is this, is that when we use the fenbendazole, it'll get 99.9% of the worms that are in the stomach, and it gets there first and automatically because it's there in the gut lumen. Then when we when we give the injectable, it takes a little bit more time to get to the site. It's coming through the tissues in which those parasites might hibernate. And then when it gets to the lumen, it's going to kill 99.9 of the 0.1% that fenbendazole might have left. So if you're thinking about resistant parasites, using the fenbendazole with your Ivomec, highly advantageous and thought process, and there's papers to show that it's effective. I hope you've enjoyed today's show. That's a crash course in pharmacology and nutrition and feeding, but you can see there's a lot of tools out there that we use on a day in, day out basis that really do decrease our cost and increase the potential of our animals to earn us a living. I appreciate you watching the show. Two things. You have to have a VFD when you use antibiotics in the feed, or if you use some of these products in combination with antibiotics. So you have to have a VCPR and work with your local veterinarian. We do not use any antibiotics in our industries to promote growth. We only use them to prevent, control, and treat diseases. I'm Dr. Dan Thomson. If you want to find us on the web at DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson, and I'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.